Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Causes of hip pain when walking and treatment options. Hip pain with walking has various causes that affect the bones, joints, tendons, or muscles of the hip joint. Diagnosis and treatment depend on what part of your hip hurts and your medical history. /r/n/r/n While hip pain is common in older adults, it can affect people of all ages. Hip pain can affect one hip or both hips. It can originate from the hip muscles or the joints of the hips and can lead to pain and soreness with walking or other movement. /r/n/r/n Hip pain can affect the entire hip or just the inner or outer part. Depending on the cause, it may start subtly with stiffness and discomfort and worsen over time, or it can be sudden and painful. Since you cannot avoid walking or movement, it is crucial to determine the cause of hip pain and how to treat it best. /r/n/r/n This article will explain the various causes of hip pain when walking, walking with mild hip pain, treatment for moderate to severe hip pain, and more. /r/n/r/nJanOtto, Getty Imagesrnrn According to a 2015 study, hip pain when walking is a common problem related to a variety of causes. /r/n/r/n Causes of hip pain with walking may include /r/n/r/n different types of arthritis, including rheumatoid arthritis, RA, osteoarthritis, OA, and traumatic arthritis, can lead to the deterioration of the cartilage of the hip joints. The cartilage in the hip acts as a cushion between the ball and socket joints, allowing the ball to glide and rotate smoothly with movement. /r/n/r/n When the cartilage is damaged, movement can become difficult and may be painful. The thinning of the cartilage also narrows the space between the bones. In advanced cases, bone will rub on bone, causing pain and stiffness, especially with movement. /r/n/r/n Friction between bones may also lead to bone spursbone growth at the edge of bones. /r/n/r/n Inflammatory arthritis types like RA can lead to fluid buildup in the joints. Fluid buildup can occur anywhere in the body, including in the hip joints. It can cause joint pain, swelling, and pain when walking or performing other movements. /r/n/r/n Trochanteric bursitis is a type of bursitis that causes painful swelling near the hip joint. Bursitis is swelling in a small, fluid-filled sac called a bursa. Bursae, plural of bursa, cushion bones and other tissues. /r/n/r/n Trochanteric bursitis affects the pointed upper, outside edge of the femur, the thigh bone, called the greater trochanter. It happens when the bursa covering the greater trochanter becomes damaged or inflamed. It can cause pain and difficulty with walking. /r/n/r/n Hip tendonitis is caused by inflammation of the tendons in the hip flexor muscles, which help lift the leg. It is usually the result of overworked muscles. /r/n/r/n A hip fracture is a break in the top of the femur. It is treated with surgery. A hip fracture may cause significant pain in the hip or groin, and some people with hip fractures might not be able to walk. /r/n/r/n Others can walk but have vague pain in the hip, buttock, thigh, groin, or back. Hip fractures are more common in older adults and often occur after a fall or other trauma. They are also common in people with osteoporosis, a bone-weakening disease. /r/n/r/n A hip dislocation occurs when the end of the hip bone moves, or is moved, out of the hip socket. It is a medical emergency that can cause severe and disabling pain. It may also affect the ability to walk and cause pain with walking. /r/n/r/n Infections and inflammatory conditions of the hip joint can cause severe pain with walking. This includes osteomyelitis, toxic synovitis, and sacroiliitis. /r/n/r/n Osteomyelitis of the hip is inflammation of the hip bone caused by a bacterial infection. /r/n/r/n toxic synovitis is an inflammatory condition of the hip joints that primarily affects children. It causes pain across the hip area that worsens when bearing weight. /r/n/r/n sacroiliitis is inflammation of the area where the sacral spine meets the pelvis, which causes pain that worsens with walking and standing. /r/n/r/n a hip labral tear involves the labrum, the ring of cartilage that lines the outside rim of the hip joint socket. The labrum cushions the hip and acts like a seal to hold the ball at the top of the femur, thigh bone, within the hip socket. /r/n/r/n repetitive motions, usually from exercise, can strain the muscles, tendons, and ligaments that support the hips. A hip strain can lead to pain and walking troubles. /r/n/r/n avascular necrosis occurs when there is blood loss to the hip, and parts of the bone start to die off. Causes include trauma, corticosteroid use, or radiation treatment. /r/n/r/n sometimes, hip pain with walking isn't directly related to a hip problem but rather a problem of the lower back. Sciatica or lumbar spinal stenosis can cause pain that radiates into the hip or leg and affects your walking. /r/n/r/n sciatica is pain that travels along the path of the sciatic nerve, the nerve that starts in the lower back and runs down each leg. It causes inflammation, pain, and numbness along the affected leg. /r/n/r/n lumbar spinal stenosis is a narrowing of the spinal canal that compresses the spinal cord or nerve roots. Depending on the area of the compression, it causes pain and numbness in the hands, arms, hips, buttocks, legs, and/or feet. /r/n/r/n knee pain, whether related to arthritis or an injury, can put extra pressure on the hip, triggering hip pain when walking. /r/n/r/n some people experience hip pain while walking on a treadmill because it can disrupt natural waking patterns and cause inflammation and dysfunction. /r/n/r/n hip pain while on a treadmill can also be the result of overuse and repetitive stress from frequent use, inadequate footwear, or a pre-existing condition. /r/n/r/n gynecologic conditions such as dysmenorrhea, painful menstruation, endometriosis, and adenomyosis can also cause hip pain with walking. /r/n/r/n severe abdominal cramping from menstruation can cause pain that radiates to the back, hips, and legs. /r/n/r/n endometriosis, a condition in which tissue similar to the uterine lining grows into other tissues, can affect the nerves in the pelvis and lead to hip pain. /r/n/r/n adenomyosis is when the endometrial lining spreads into the muscular layer of the uterus. It causes an enlarged uterus, heavy menstrual bleeding, painful periods, and hip and pelvic pain. /r/n/r/n the prevalence of hip pain in the general population is 10%, and your risk of hip pain increases with age. /r/n/r/n additional risk factors for hip pain include, /r/n/r/n hip pain can be felt in several areas, including the thigh, inside the hip joint, down the legs, in the entire pelvis, and in the buttocks, making it harder to determine what is causing the pain when walking. /r/n/r/n it may be a hip issue, or it may not be related to the hip. Hip pain when walking can be a problem with the hip joint or with hip muscles. /r/n/r/n the affected joint will typically swell if hip pain is related to a joint problem. The joint will hurt not just while walking but also when resting. Joint pain related to a hip issue can be dull, achy, and throbbing. Pain will mainly be felt at the front of the hip, but it can radiate into the groin and down into the buttocks and the knee on the affected side. /r/n/r/n muscle spasms accompany muscle pain, which subsides with rest. Conditions that affect the tendons can cause pain in the muscles and tendons of the front, side, and back of the hip. You may experience burning pain on the side of the hip and the inside. Pain might also be felt near the groin. /r/n/r/n. A good walking form may help when you've had hip pain when walking. Consider the following: /r/n/r/n. If your hip pain with walking is mild, you can do things to manage the pain and reduce strain on the hips. /r/n/r/n. If your hip pain lasts more than a few days, contact a healthcare provider. They can run tests to determine the cause of symptoms and treat your condition. /r/n/r/n. You should see a healthcare provider immediately for hip pain with the following characteristics. /r/n/r/n. Seek immediate medical care for hip pain accompanied by /r/n/r/n. These might be signs of an infectious condition, such as osteomyelitis. Left untreated, osteomyelitis may cause abscesses, pockets of pus, osteonecrosis, bone death, and, in children, slowed bone growth. /r/n/r/n. Treatment for hip pain will depend on the cause. Some causes, like a minor sprain or a pinched nerve, may improve over time and might not need treatment. /r/n/r/n. Other causes can be treated with physical therapy to strengthen the hip joints, back, and abdomen, which can lead to less pain when walking and running. /r/n/r/n. Additional treatment options for hip pain include /r/n/r/n. Discuss your treatment options with a healthcare provider. They can assess you to determine the cause of symptoms and create a treatment plan to manage moderate to severe hip pain. /r/n/r/n. Walking can be helpful for managing pain. However, it is vital to listen to your body and adjust your walking and activities in a way that manages and reduces pain. /r/n/r/n. If you have hip pain while out walking, consider the following. /r/n/r/n. Your individual experience with hip pain while walking may vary. Contact a healthcare provider for advice on how much rest and activity can help manage hip pain. /r/n/r/n. Hip pain while walking is a common complaint. Many causes of hip pain exist, including arthritis, trauma, overuse, infection, inflammation, or a back or spine problem. Some of these issues are serious and chronic, while others are short-term and can improve over time. /r/n/r/n. Hip pain can usually be treated and managed, and mild pain while walking can be managed with things like using a cane or wearing supportive shoes. In some cases, you may need long-term care, like physical therapy. Surgery is typically a last resort option and is used in cases of fracture or joint damage. /r/n/r/n. Contact a healthcare provider if you experience severe pain while walking, are unable to bear weight, or are experiencing signs of infection, such as fever or chills. /r/n/r/n. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.